Good evening from India. I'm Dr. Sonia Jaiswal from the Department of Anatomy at ERA's Lucknow Medical College. I've been a dentist all along, right from the year 2005 at ERA's Lucknow Medical College to the year 2012. And I switched over to teaching anatomy now. And since there is a little bit of time constraint, I would just incorporate a few streams in terms of the history of health professions education. I start with the history of dental education. May I request all the others to kindly mute themselves so that, um, thank you. So it was in the year 5000 BC that a Sumerian text described toothworms as the cause of dental decay. It was in the year 2600 BC that Hesi Ray was an Egyptian scribe who was often called the first dentist. There was an inscription on his tomb which included the title, "The greatest of those who deal with teeth and of physicians." And this is perhaps the earliest known reference to a person who was a dental practitioner. In the year 500 or to 300 BC, Hippocrates and Aristotle wrote about dentistry, and that included the eruption pattern of teeth, treating decayed teeth and gum diseases, extracting teeth with forceps, and using wires to stabilize loose teeth and fractured jaws. In 1723, Pierre Fauchard, he was a French surgeon who published The Surgeon Dentist. That was a treatise on teeth. That was also called the Le Chirurgien Dentist. Fauchard is credited as being the father of modern dentistry because of his book that describes a comprehensive system for the practice of dentistry. And it included basic oral anatomy and function, operative and restorative techniques, and denture constructions. Horace Hayden and Chapman Harris in the year 1840 found the world's first dental school, and that was the Baltimore College of Dental Surgery. And that was established as the Doctor of Dental Surgery, or DDS degree in the West. It's a BDS here in India. Then comes the evolution of nursing as a profession. I would ask for forgiveness that, there's a huge amount of text that is available, but since there is a constraint of time, I'm just including a few slides. This, of course, is a picture of Florence Nightingale, who was born in the year 1820 on May 12th. She served as a nurse during the Crimean War, and she tended to wounded soldiers. She was also called the Lady with the Lamp, and that was because she was always making rounds at night. She's the founder of modern nursing and laid down professional nursing, a nursing school at the St. Thomas Hospital in London. And that was the first secular nursing school in the world, and it is now part of the King's College London. So there was this American Red Cross Society, and if you can just see the slides here. I'm sorry with this. So Clara Barton was the founder of American Red Cross, and that tended to all the soldiers on the battlefield, and she was into cleansing the wounds and meeting their basic needs, and of course comforting them in death. Then Dorothea Lende, Dix, Mary Ann Ball, and Harriet Tubman, they were also influencers during the Civil War. And of course, Mary Mahoney was the first African-American professional nurse. Nursing in hospitals expanded during the late 19th century. Then there was another branch that has gradually bloomed, and that is physiotherapy. So the science of physiotherapy is believed to have been practiced as early as 400 BC by Hippocrates and Galen. And there were physicians who advocated manual therapy techniques, massage, hydrotherapy methods in treating their patients. In the year 1930, the School of Physiotherapy was opened at the University of Otago in New Zealand, and the Reed College in Oregon. With the inception of the science of physical therapy, the concept of spinal manipulative therapy also became a major element of practice. And of course, in 1974, there was this International Federation of Orthopedic Manipulative Physical Therapists. And this was, again, this, of course, is playing a major role in the global development of the field of physiotherapy. There was emergence of the field of pharmacy. And there was another Greek who was working in the Roman army, and that was Galen, who brought together centuries of medical and pharmacological knowledge together. And his work became for about 100 years, to be precise, and he was the one who took out ways to extract medicinal treatments from herbal plants and it was called the Galenical pharmacy. There are some interesting facts that I just wanted to share. That the first ambulance was designed by Dominic Jean Larrey. That was in the year 1766. And he was also a part of the Napoleon Bonaparte's medical chief. So with this, there's just a small take-home message. Of course, Zaidi sir has spoken at length about the history of medical education, and I have incorporated just a few slides for the other health profession education, and I'm extremely sorry if I have missed out a few because there is time constraint. So we've talked about the educational theories, the frameworks, principles, and social practices, the technological advances, which of course in the subsequent module, you will module 1.2 and 3, you will be learning about these. And they have emerged over a period of time and have, of course, contributed to the current teaching learning sessions, the assessment tools, the various curricula, the evaluation processes, and the student-teacher interaction models. So there are some future trends in the health professions education, which is to prepare better health professions for the future for more collaborative practice. There will be some longitudinal integrated clinical education that is more patient, community, and chronic disease oriented, as Sir has already talked about. Education in the social determinants of health and social, of course, humanistic missions of the health professions education. So more emphasis is laid down on the continuation of health professions education for lifelong learning and long-term well-being of health professions. There is a shift from a competency-based timetable and from variable health professions education to better fulfill our social contracts and to produce the most competent practitioners most efficiently. The integration of artificial intelligence and new educational information technologies into the continuum of health profession and education and practice, which of course Sir has talked about at length. So these are some of the references. Of course, there are plenty of them, but these are a few which I have incorporated. So thank you very much.